Hey everyone, welcome back to Speak Healthy. Today's topic will be all about familial hypercholesterolemia. Familial hypercholesterolemia, or FH, is a genetic disorder that affects the way the body processes cholesterol, leading to high levels of low-density lipoprotein, LDL, cholesterol in the blood. This condition can significantly increase an individual's risk of developing heart disease, including heart attacks and strokes. Despite its serious health consequences, FH often goes undiagnosed, making it important to raise awareness about this condition. In this video, we will explore what familial hypercholesterolemia is, its causes, symptoms, and potential health risks. We will also discuss the various treatment options available for managing FH, as well as tips for living with this condition. Whether you have been diagnosed with FH or are simply interested in learning more about it, this video will provide a comprehensive overview of this complex and often misunderstood condition. Number 1. Definition and causes of familial hypercholesterolemia. Familial hypercholesterolemia, or FH, is a genetic disorder that results in abnormally high levels of low-density lipoprotein, cholesterol in the blood. LDL cholesterol is often referred to as bad cholesterol because it can contribute to the buildup of plaque in the arteries, which can increase the risk of heart disease, heart attacks, and strokes. FH is caused by mutations in one of these three genes: LDLR, ApoB, or PCSK9. These genes are responsible for producing proteins that help regulate the metabolism of LDL cholesterol. FH differs from other types of high cholesterol in that it is primarily a genetic disorder rather than a lifestyle-related condition. While factors such as diet, exercise, and weight can influence cholesterol levels, individuals with FH have inherited a genetic mutation that makes it difficult for their bodies to remove LDL cholesterol from the blood. This can result in LDL cholesterol levels that are 2 to 3 times higher than normal. The genetic mutations that cause FH affect the way that LDL cholesterol is metabolized in the body. In a healthy person, LDL cholesterol is taken up by liver cells and broken down or recycled. However, in individuals with FH, the genetic mutations prevent this process from functioning properly, leading to a buildup of LDL cholesterol in the blood. The severity of FH can vary depending on the specific gene mutation involved and whether the person has inherited 1 or 2 copies of the mutated gene. FH is an autosomal dominant genetic disorder, meaning that a person only needs to inherit 1 copy of the mutated gene from either parent to develop the condition. If a person inherits 2 copies of the mutated gene, 1 from each parent, their FH is likely to be more severe. Since FH is a genetic disorder, it tends to run in families, and individuals with a family history of high cholesterol or heart disease may be at high risk of developing FH. Number 2. Symptoms and diagnosis of familial hypercholesterolemia. Familial hypercholesterolemia, or FH, often does not cause any obvious signs or symptoms until later in life when heart disease has already developed. This is why it's important to be aware of the condition and to get tested if you have a family history of high cholesterol or heart disease. One of the most common signs of FH is high cholesterol levels, particularly LDL cholesterol. Individuals with FH have high LDL cholesterol levels that are 2 to 3 times higher than normal, even if they follow a healthy diet and lifestyle. This can put them at increased risk of developing heart disease and other cardiovascular conditions. Another sign of FH is the presence of xanthomas, which are yellowish fatty deposits that can appear under the skin around the eyes, on the hands, or on the elbows. These deposits are a result of the accumulation of cholesterol in the body and can be a visible sign of FH. FH is often diagnosed through a combination of physical exams, blood tests, and genetic testing. A healthcare provider may perform a physical exam to look for signs of xanthomas or other visible symptoms. Blood tests, including a lipid panel, can be used to measure the cholesterol levels in the blood. If these tests suggest FH, genetic testing may be ordered to confirm the diagnosis. Genetic testing involves analyzing a person's DNA to look for mutations in the genes that are associated with FH. Genetic testing can help to identify individuals who are at high risk of developing FH even if they do not yet show any symptoms. It can also help to identify family members who may have inherited the same gene mutation. Since FH is a genetic disorder, it's important for individuals with a family history of high cholesterol or heart disease to talk to their healthcare provider about getting tested. Early diagnosis and treatment can help to reduce the risk of developing heart disease and improve outcomes for individuals with FH. Number 3. Health risks associated with familial hypercholesterolemia. Untreated familial hypercholesterolemia can lead to serious health consequences, including an increase of heart disease, heart attacks, strokes, and peripheral arterial disease. Individuals with FH are at higher risk of developing heart disease than the general population, with estimates suggesting that they have up to a 20 times greater risk. This is because high levels of LDL cholesterol can contribute to the buildup of plaque in the arteries, which can restrict blood flow and increase the risk of heart attacks and strokes. In addition to heart disease, untreated FH can also lead to peripheral arterial disease, which is a condition that affects the blood flow to the arms and legs. This can cause pain, numbness, and weakness in the affected areas, and can increase the risk of infections and ulcers. Individuals with FH may also be at risk of developing aortic stenosis, a condition in which the aortic valve becomes narrowed, reducing blood flow from the heart to the rest of the body. This can lead to chest pain, shortness of breath, and even heart failure. The health risks associated with FH can be particularly significant for individuals who have inherited 2 copies of the mutated gene, one from each parent. These individuals are likely to have more severe FH and may develop heart disease at a younger age. However, it's important to note that FH can be effectively managed with early diagnosis and treatment. Lifestyle changes such as a healthy diet, regular exercise, and weight management can help to reduce cholesterol levels in the blood. Medications such as statins, bile acid sequestrants, and PCSK9 inhibitors can also be used to lower cholesterol levels and reduce the risk of heart disease. Regular monitoring and management of FH can help to prevent or delay the onset of serious health consequences and improve outcomes for individuals with the condition. Number 4. Treatment options for familial hypercholesterolemia. There are several different treatment options available for familial hypercholesterolemia, which can be tailored to each individual's needs based on their cholesterol levels, medical history, and overall health. One of the first-line treatments for FH is lifestyle changes, such as adopting a healthy diet and increasing physical activity. A diet low in saturated and trans fats and high in fruits and vegetables and whole grains can help to reduce cholesterol levels in the blood. Regular exercise, such as 30 minutes of moderate activity most days of the week, can also help to lower LDL cholesterol levels. In addition to lifestyle changes, medication is often used to manage FH. Statins are a type of medication that can effectively lower LDL cholesterol levels by blocking the production of cholesterol in the liver. Other medications that may be used to treat FH include bile acid sequestrants, which work by binding to bile acids in the intestines and preventing them from being reabsorbed into the bloodstream, and PCSK9 inhibitors, which can help to lower LDL cholesterols by increasing the liver's ability to remove cholesterol from the blood. For individuals with severe FH who do not respond to lifestyle changes and medication, LDL apheresis may be an option. This procedure involves filtering cholesterol from the blood using a machine similar to a dialysis machine. This procedure is typically done every 2 to 4 weeks and can effectively lower LDL cholesterol levels in the blood. Each treatment option has its own benefits and drawbacks. Lifestyle changes can be effective, but may be difficult for some individuals to sustain. Medications can effectively lower cholesterol levels, but may have side effects or interactions with other medications. LDL apheresis is a more invasive procedure and may be more expensive than other treatment options. Number 5. Management of familial hypercholesterolemia in children and adolescents. Early detection and treatment of familial hypercholesterolemia in children and adolescents is crucial to prevent the development of heart disease in adulthood. Children and adolescents with FH are at an increased risk of developing atherosclerosis and other cardiovascular diseases, and early intervention can help to mitigate this risk. The management of FH in children and adolescents may differ from that in adults, as their bodies and lifestyles are still developing. In general, lifestyle changes such as a healthy diet and regular physical activity are important for all individuals with FH regardless of age. However, children and adolescents may require additional support and guidance from healthcare providers and dietitians to establish healthy habits. Medication is also an option for children and adolescents with FH, particularly those with very high LDL cholesterol levels. Statins are the most commonly used medication for children and adolescents with FH and have been shown to be safe and effective in this population. However, as with all medication, the risks and benefits should be carefully weighed, and children and adolescents should be monitored closely for any side effects. In addition to medication and lifestyle changes, regular monitoring of cholesterol levels is important for children and adolescents with FH. Healthcare providers may recommend regular blood tests to assess cholesterol levels and adjust treatment as necessary. It's important to note that children and adolescents with FH may require ongoing management into adulthood. Regular follow-up with healthcare providers and ongoing support and education can help individuals with FH to maintain healthy cholesterol levels and reduce the risk of developing heart disease. Number 6. Living with familial hypercholesterolemia. Living with familial hypercholesterolemia can be challenging, but with proper management and support, individuals with FH can lead healthy, fulfilling lives. Here are some tips for managing FH. Maintain a healthy diet. A diet that is low in saturated fat and cholesterol can help to reduce LDL cholesterol levels in individuals with FH. Focus on consuming a variety of vegetables, fruits, whole grains, lean proteins, and low-fat dairy products. Avoid processed foods, fried foods, and high-fat meats. Stay active. Regular physical activity can help to improve cholesterol levels and overall cardiovascular health. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Take medication as prescribed. If medication is prescribed, it's important to take it as directed by your healthcare provider. This can help to reduce LDL cholesterol levels and lower your risk of developing heart disease. Get regular checkups. Regular monitoring of cholesterol levels and cardiovascular health is important for individuals with FH. Be sure to attend regular appointments with your healthcare provider and follow their recommendations for testing and treatment. Seek support. Support from healthcare professionals, family members, and support groups can be invaluable for individuals with FH. Consider joining a support group for individuals with FH or connecting with others who have the condition through online communities. Educate yourself. Learn as much as you can about FH and how to manage it. Talk to your healthcare provider about any questions or concerns you may have, and stay up to date on the latest research and treatment options. Living with FH can be challenging, but with a proactive approach to managing the condition and the support of healthcare professionals, family members, and support groups, individuals with FH can live healthy, active lives and reduce the risk of developing heart disease.